everybody. Welcome to this episode of the Real Talk podcast. So today we're covering a bunch of feedback over the last few episodes, but we're doing something a little different. So for any of you listeners who've been with us quite a while, you'll know that we usually do an episode or a couple episodes, and then we'll do a bunch of feedback between Tyler and myself. But now we're going to bring on a guest for this episode, partly just because it's such a complex topic and there's a lot of numbers and stats to
we're
wade
trying to
through.
put COVID to bed.
And let's see what we can do on that.
Yeah.
But also just to shake it up and keep it fresh. And yeah, we hope to make, I know the whole goal of this all the time was to make it a place for conversation and to inform you and to also inspire you to your own conversations. So we're hoping to make it sort of a spot where we can bring in listeners who want to have a say on feedback episodes and kind of do a rotating cast of guests.
Yeah, instead of us just jabbering. Maybe we'll have a few returning guests, but we were throwing the idea around of having a listener or two on to chat about different viewpoints on the episode that we just did. So, or episode or two, depending on how frequent we do it. But hopefully we can, bring maybe, if you're interested, you can, write us on an email and we can bring a listener on and you can challenge us.
Yeah.
People like to do that in an email. Maybe they'll like to do it live.
Yeah. So add that to your feedback now, folks. If you want to come on the show, let us know.
Let us know why we should pick you to come on the show.
Yeah. Not that it's some big honor, but it'd be good to have you.
It doesn't pay either.
No. We'll give you a high five. So anyways, so we have a special guest on today, but before I intro him, let's just hit a few highlights on some of the other feedback we got on previous episodes with the one we did with Brent Vanderwood on what is money, and also with Sam Say on critical race theory. So Ty, maybe what are you hearing from people on that episode we did with Brent?
Yeah, that was I think it was really well received. We got a bit of pushback on the fact that he isn't an accountant or a financial advisor.
That's true.
But no, he's really well researched and yeah, I mean, what am I going to say bad about my brother, right?
Oh, fair enough. I felt people appreciated it. It opened their eyes. It was a perspective they hadn't heard.
I think we pushed Bitcoin a little too much, or we hadn't intended to talk about Bitcoin as like, the solution to the world, but also that's kind of the way it went. But I think a good background in money got people thinking. So that's hopefully something that we maybe develop in another episode. But I think in general, it was just kind of informative for people.
Yep. And if people have ideas for future guests to have on that would have different perspective on what is money and how to be a responsible steward with the gifts God's given us, then we're totally open to it. And then the other one was Sam Say. Didn't get a ton of feedback on that one, but I think it was, again, just kind of generally people appreciated the talk on critical race theory. You see it a lot. I'm sure our guests will know this in the education system as well. And it's an important topic.
We've been talking about Bill 67 afterward with the Ontario government, and I'm sure some of our listeners have heard, guys like Jordan Peterson talking about it, and Rex Murphy was going on about it too, and that's a bill laden with this stuff. So that was definitely one of the things that came about since that episode. That was like, okay, now this is probably why we should all care. So if people are wondering about that, I would recommend going back and listening to that because it was informative from a different perspective for sure.
Yep, Sam's got a great way of talking about that stuff, and he's on the ball there. So it was a pleasure to speak with him. Okay, well, I've been teasing this long enough. So our guest for today, who's a very patient man, been waiting throughout all of our blabbering here, is Ed Bosveld. He is a professor, make sure I get this correct, adjunct lecturer in law and public policy at Redeemer. And he's got a few other things on the go. So maybe I'll throw it over to Ed to introduce himself, and then we'll get into some of the feedback.
Yeah, thanks. And thanks for having me. Really excited to be here. And, I'm surprised people aren't tired of talking about COVID yet, but maybe after tonight. So, so for a few years, I've been teaching public policy at Redeemer to third and fourth year students mostly. And so throughout the last couple of years, I mean, the pandemic has really been a real life exercise in public policy. And I know my students have paid a lot of attention to that. How are policies being made and how are they being evaluated and what's the evidence behind them and so on. So I've spent much of the last 2 years looking at the data and looking at the way policy is being made and how it's being evaluated and so on. And I'm always happy to talk about it. especially because my family really doesn't want to hear about it anymore. So it's always good when I can get out of the house and talk to somebody else about it instead.
Yeah.
We're just trying to find people to listen to us too.
Yeah. We're in the same boat. Nah, that's good. So yeah, obviously, it was a big episode. A lot of you guys listened to it, and yeah, once again, just thanks to Sam and Will for coming on and engaging. That was that was very nice of them to do. Obviously, they took a risk doing that with their jobs, and that was much appreciated. So even if there was frustration with some of their points for sure, and disagreements, it's something it's good that we can have an open discussion and talk about it first and foremost. So. But anyways, we'll kind of run through all the key concerns. I kind of compiled them all into this nice little Google Doc. And then actually Sam took the time to respond to quite a number of these points too, which again is appreciated. And so we're kind of going to work through them one by one. And then I'll provide the criticism and maybe give Sam's point of view, and then we'll flip it over to Ed, and then he can kind of respond. And because he's been, in the thick of it on all the stats and whatnot. So should be interesting. And then, interject if you got any questions there.
I got a quick question. What made you interested in all the stats? First of all, you're teaching public policy, but is there did you have a specific interest in COVID and in specifically, I guess?
Well, I like numbers. I like stats. I like, risk analysis and things like that. And, but I'm really interested in public policy, how is public policy formed? And if you think about it, when we talk about COVID, most of what we're talking about is public policy, right? So the government did this or didn't do this, or imposed masks or closed schools, where these are all public policy decisions. And generally, if you talk to people about public policy, their eyes start to roll. It's kind of boring, but all of a sudden, public policy is something that everybody talks about, and so all of a sudden there's this situation, this real life situation where public policy is really affecting everybody. And people have a lot of questions about it, right? So, why did we do this? And did this make sense? And, and governments are struggling to deal with a new situation and create public policy where maybe there's not enough information. So the whole public policy process of how a policy is designed and implemented and evaluated and measured, all of a sudden that has a whole lot of really, practical impact on people's lives. I mean, it always did, but with COVID, people actually start to notice it. So, and one of the things I found was that it was difficult to find good information, right? So the pandemic discussions became polarized pretty quickly, right? You're on one side or you're on the other side. And I really think it's important to try to go back to the data and the evidence, and even where it's not always as clear as it could be, to look at it and say, hey, look, this is fact as far as we can determine it right now, and maybe take some of the polarization out of it, and say, well, maybe we can agree on some key facts or some key data, or at least talk about making policies based on more on evidence and less on politics, maybe.
Right. That would be the goal.
Yeah. All right, well, let's roll through and see.
We'll get into it. So, feedback point number 1. So there was concern with changing and incorrect modeling that undergirded government policies. So Sam responded to this saying, modeling has been wrong in overestimating the impacts of COVID, especially at the beginning of the pandemic, but it has also been wrong in underestimating. If you look at the science table projections, that's from the Ontario government, for the current wave, they predicted lower hospitalizations that have actually been occurring. And the alternative to not fantastic data is pretty much no data. So it's still necessary to use the data that you have and to make decisions from that. So Ed's been through all this stuff. What were your thoughts on that, Ed?
Yeah, I mean, modeling has been, I think a really sore point for a lot of people, right? And we've all heard and possibly sometimes joked about the Ontario science table models that, had just massive numbers. And, we still hear massive numbers sometimes. And are there models that are too conservative? Maybe. Generally, though, that hasn't been the issue throughout the pandemic, or maybe we just don't hear about those. And if we go right back to the very start of the pandemic, there was modeling done out of the UK that really shaped a lot of countries' response. And it was really, really scary, right? Millions and millions and millions of people were going to die. And, and a lot of government response was based on that. And to be fair, I mean, this was a new virus and this was a new situation. Nobody really knew what to do. So maybe you're going to go with the best information that you have, and that's understandable. And you prepare for the worst. I mean, I remember, in March, April of 2020, Canada federal government saying, we've ordered 40,000 ventilators, right? Because we are going to we're going to run out of ventilators, right? We're going to have to make ventilators out of vacuum cleaners, and so this was what we all understood at that time. Well, if you look, Ontario right now has got, I think, 82 people on ventilators, and across Canada, maybe there's a couple hundred, right? So 40,000 ventilators. I mean, I don't know where they are. Maybe they can be stored for the future,
warehouse in Mississauga,
or turn back into vacuum cleaners or whatever. But
yeah.
At that time, that was the only information that we had. So I think we have to cut decision makers some slack for saying, early on, there's just so much that we didn't know. But as we got into the pandemic, we got a year in. I mean, we're in 2 years now. I think there's a lot more information, and I think maybe there's a little bit of less of an excuse for bad modeling. And I think a few things have happened with the modeling that have really led to problems. And one is the modeling often assumes that everything the virus does is controlled by human beings, right? So and that's just not been true for any virus or really any wild thing in nature or in creation. But the idea that, okay, the virus will do this unless we do this. All right. And that's often been the foundation for government policy, right? Well, according to this model, if we don't do something now, this is what's going to happen. And it doesn't, those models often don't acknowledge the reality that the virus does stuff on its own that we don't always understand. So I spend a lot of time looking, for example, at cases rising and falling in different countries, right? And there are certain patterns, there's certain seasonal patterns. Sometimes they go, there may be geographic patterns, relating to climate. There's a lot that we just don't actually know. But the models often just assume it's like pushing buttons, right? And if we push this button, then the cases are going to go down. And if we push this button or fail to push this button, cases are going to go up. And the problem with that is, I mean, first of all, it's not realistic. It's not the way it works. But it also starts to undermine trust in modeling, right? So you said this was going to happen. You said we were going to have, hundreds of thousands of people, in hospital or whatever else. And when that doesn't happen, people start to get a little bit suspicious. So that's been an issue with the modeling, and I still don't see it changing. Each time a new model comes out, I read it, and it's still like everything is dependent on human beings. And I think it's a little bit arrogant that we can just change the course of something like this. I mean, I don't think we'd say that with with a snowstorm or a hurricane or whatever else. And that's not to say we can't do things to mitigate a virus and a pandemic. I mean, certainly we can. But just the idea that we can just control it, and that everything happens or doesn't happen because of what we did. Cases go up, and especially early in the pandemic, right? Politicians would be, well, those young people out there are doing this, or people aren't doing this, or people aren't doing this. And the cases will go down, or be, people did the right thing, and so on. And I think thankfully, provincially we're getting away from that a little bit now. So Dr. Moore yesterday was like, no, we're not imposing new measures.
Yeah.
We think we're going to be okay. So I think that's, there have been real issues with the modeling. I think the other thing I'd say about modeling is that it's often been used kind of as a stick. So rather than providing information, which is what I think the model should be for, it's been like, we're going to use this to try to change people's behavior. So, to talk about some of the Ontario models, for example, there's often be a best case scenario or medium scenario and a worst case scenario. And what we would hear about, and this would be from politicians and public health officials and media, was always the worst case scenario, right? We could see up to 10,000 people in ICU, or we could see this, but even in the model, that wasn't exactly what, they're saying if everything goes wrong, this is where it's going to be. But that was often used to try to motivate people to behave in a certain way. And I think, again, that led to a loss of trust, and people saying, okay, well, you keep coming with these really, really scary models, and they never come true. And so next time you do it, I think you're just trying to scare me. So one of the themes for me during the pandemic has been sort of this loss of trust in institutions, in politicians, in public health, in media, in medicine, which is, I think, a really serious problem going forward. And I think the modeling has contributed to that. And I'm not saying we shouldn't do modeling. I mean, I think it's important, but we have to recognize the limitations and also just recognize it's not all about us, even if we think it is.
You have to look at the incentives too for those who do, like, who make the modeling, and then for the politicians who rely upon the modeling. Because I noticed, like, I read through that science table thing that Sam linked there, and for example, like on their slidable mask use, they cite a study, and then it had, like, they had called 1,500 people or something like that. Then only 500 had actually participated. And using that 500 person sample size, they justified mass use all across the province in all these different situations. And I think, yeah, if you're responsible for making those models and you're in a situation where you have a new disease, you're not sure how it's going to react, you're going to tend to err toward the side of, well, bigger numbers just in case. And then the politicians are going to do the exact same thing because no one wants the consequences for playing it, for loosening of restrictions and then seeing what happens.
Yeah. How much did the modeling take in consideration, like personal responsibility? Like you're saying there was a best case, middle case, and like a worst case scenario. Was the worst case scenario like everyone disregards what we're saying and goes out clubbing? Like, because there's kind of a feeling that I get that it's the modeling wasn't taking in consideration that I also have concerns the same as they do, and I'm also protecting my group of friends and family. And so did the modeling ever like show the impact of what that could or could not help, or like?
Yeah, I mean that's a great question, because that is that is something that the models have really been criticized for, including by academics and so on, and that is, um, people modify their own behavior on their own without the government always telling them to as well, right? So in the models often rely on the government does this, the government does this, or the government does this. I mean, there'll be predictions of different scenarios, right? So if people don't reduce their mobility, we're going to be in the worst case scenario, right? So mobility being one of the measures of how people act. But one of the things that's been pointed out is that people make their own choices even outside of government regulation. So if you look at Ontario right now, masks are not required in public. You go to many settings, and I would say there's 80% of people are masked, right?
Yeah.
And that's fine. They're not required to. They are choosing to. Modeling has a really hard time, certainly has had a hard time in picking up that kind of behavior.
Right.
So if cases are really, really increasing, for example, some people might just stay home who would have otherwise gone out. They might not visit a relative. They might be more inclined to stay home if they've got a runny nose, right? So that sort of thing it's quite powerful, actually, because people are smart. People often make good choices. Certainly, people will make choices for self-preservation, and the models really struggle to build that in, right? So if we are going to have an increase in cases and people are going to hear about hospitalizations, are they going to voluntarily modify their behavior? I mean, I'm fascinated. For example, if we could compare Quebec and Ontario right now, so Quebec with some mask mandates still in place, right, and a much higher level of hospitalizations and quite possibly cases, at least known cases. I wonder how many more people in Quebec are actually wearing masks, right? So in Ontario, it may well be that in some parts of Ontario, 80% of people are masked, even though it's not required. What's happening in Quebec right now? Maybe they're 80% masked, or maybe they're 75% masked. So the idea that everything happens through government regulation and restriction, I think is a flaw in the models as well. People, people choose their own behaviors, and it goes both ways. People may choose to engage in behaviors that reduce their risk on their own, but people might also choose to ignore government, restrictions on masking or whatever else. So the model based on just, we're going to impose this policy or we're going to do this, that can lead to flawed modeling as well.
Right. Yeah, it's interesting. It seems like it's a bit of a self-fulfilling prophecy now that they did the heavy-handed thing, and people are now educated. And it seems like as we move into the fall, perhaps people are going to be doing this themselves. And you're not going to see this surge in numbers, but it's because people are taking that personal responsibility, not because what we did was, what we should have been doing. Like we should maybe have just said, well, the high risk people, maybe they're doing all that already. So it's
Yeah, some of it is, I think, is about culture change, right? So North American culture, for example, I haven't missed a day of work for 30 days or for 30 years, that kind of thing, right? Well, what does that mean? It probably means you went to work sick, right? And got other people sick and so on. But we treat that as a really good thing, right? Well, you're a great employee. So your kids feel a little bit sick in the morning. Well, school's important. Suck it up. Go to school, and so on. So some of those things, if those change, that will actually make a significant difference for COVID and for other diseases as well. If we can change a culture to, hey, I'm not feeling well, I'm actually going to make sure I'm just not going to be near people till I'm feeling better. Not a real big thing, not a thing I think government can regulate very well.
Yeah.
But if that sort of cultural change happens, that may be more powerful than, for example, government restrictions or filling out endless screening forms, right? I mean,
Mm.
how often have you, been in line where they're requiring screening and they're asking, have you been this? How often have you heard somebody say, "Oh yeah, actually, now that you mention it, I do have a really bad cough and cold. I'll turn around and go home right now." I mean,
Yeah.
we go through some of these almost, ritual. It feels almost superstitious to me.
Well, because
Yeah.
it's a 12-year-old asking you the questions.
Yeah, that's right. So so some of those things would be much better off if we can sort of change our perspective on
Hmm.
on disease and that sort of thing.
Yeah, for sure. All right, let's get into vaccines, vaccine mandates. That was a big chunk of the feedback too. So point number 2 here: concern with vaccine being pushed for all ages, despite known and unknown side effects and different risk levels. So Sam's response to that was, I would argue that the data is very clear. The risk is still greater from getting COVID than from vaccination, and that is true even for quote low risk people, such as young people. However, he also notes that the promotion is not completely indiscriminate, as Moderna and AstraZeneca are not preferred for young men due to higher rates of myocarditis, which speaks to the fact that side effects are to be taken seriously. So that was Sam's response. Yeah, I'll throw it over to you, Ed, for what do you think about that?
Yeah. So I think there's a number of really big mistakes we've made through the pandemic, and I'm not saying that they could have been avoided. I mean, this is a new thing, and we're trying to figure out as we go. But one of the really big mistakes I think that has often been made right from the beginning is that we ignored the age stratification of risk. So there's not enough attention paid to who is at risk and why. And in fact, sometimes the messaging has been the opposite. So there'd be local medical officers of health, saying the virus does not discriminate. We are all everybody's equally at risk. The virus does not discriminate, and it's simply not true,
Yeah.
right? I mean, that is simply not based on evidence, data, and so on. And the reason I think that we're hearing that messaging is they don't want some people to just relax and go out and
Yeah.
breathe moistly or whatever, right? Because
Speak moistly too much.
right. But it's simply, from my point of view, it's not even really honest messaging, because we
No.
know that the risks for certain people are massive, right? And I think those are actually underplayed sometimes. I mean, if we look at COVID deaths in Canada in people 80 plus, I mean,
Mhm.
if somebody in that age group gets COVID, I mean, their risk of dying is really, really, really high. All right. And sometimes I actually think that when we just talk about everybody being at risk, we actually minimize the risk to some people who are at really high risk. And then at the other end, I mean, the risk, for example, to children is very, very, very low. And one of the things that's just been remarkable, I think it's even worse in the States than here, is just how we have obsessed on the risk to children, even though the evidence and the data is just so clear. So,
Mhm.
Dr. Moore had a press conference yesterday, and this is a question he was asked by the media, oh, there's all these kids going into ERs and whatever else, when are you going to bring masking back in schools? And Dr. Moore said, we've got 2.75 million children in Ontario, and there's currently 2 of them in ICU related to COVID. 2 out of 2.75 million.
Mhm.
All right. So, and I mean, obviously, you wouldn't want to see anybody in
Sure.
ICU, with COVID.
Yeah.
But still, that's pretty astounding, right?
Yeah.
Because if you would compare that risk to things like playground accidents or car accidents or
Anything else?
drownings or whatever else, right? They're
Mhm.
they're not even comparable. So this failure to, I think, adequately talk about the age stratification of risk, I think it's been really a problem, and that's tied into vaccination as well, because if you and again, these are this is just data. If you take an unvaccinated 20-year-old, this person is at much less risk of COVID than a vaccinated 80-year-old. I mean,
Mhm.
that's just
Yeah.
statistics, right?
Yeah.
And that's not to say maybe the 20-year-old should get vaccinated. I mean, I believe that vaccination is a medical decision that should involve a risk benefit analysis, and you have to say what are my risks and what is the benefit. And I think that's true for any age group. And I think for some age groups, particularly the elderly, I think that risk benefit balance is really, really tilted toward vaccination. but it gets much trickier when you get to younger people, and particularly when you get to kids. This is not something that, I'm just making up. I mean, there's a lot of countries that have said, if you read the UK's, Joint Committee on Vaccination and Immunization, they make recommendations. They've said this is such a fine balance for kids.
Yep.
Very, very low risk of COVID and a very low risk vaccine. So you got one really low risk, and you're going to mitigate it with this other low risk, which has some unknowns to it. And they both may have some unknowns to it. And you end up kind of in this, well, it's almost a tie game, right? So, is this really necessary? So one of the things that I think I've been disappointed in is, I'm not sure we've adequately realized that, if we could vaccinate 1,000 more 80-year-olds, the impact of that is going to be greater in terms of preserving lives, protecting the healthcare system, than maybe vaccinating 100,000 children. And I think that's often been lost, and I think that's a really serious problem because we may not be getting enough to the people that are at risk. And I know there's certainly efforts to be made, but we say some, we've vaccinated 98% of seniors, or 99% of seniors. There still are fairly significant numbers that are not vaccinated, and the rate of serious illness and death in those people is very, very high. So yeah, so I wish there was a more an approach that was more open about the risk. And this also true with comorbidities, right? So we know now, we didn't know 2 years ago, but we know now that certain conditions make people at much, much greater risk of COVID. Well,
when did we know that? Like a year ago?
yeah, I mean, it's an ongoing thing, right? I mean, and it used to be, for a while they thought asthma was a risk factor, and then it turned out it wasn't, right? So you get more data, and that's fine, that's going to happen. But there's certain things that we know, right? So obesity, high blood pressure, and so on. So you'd think that we'd be talking a lot about, hey, if you have these characteristics, you're older, maybe your weight is more than it should be, you've got high blood pressure, you're in this super high risk category, right?
Yeah.
But instead, again, we've tended to say everybody's at risk, everybody should get vaccinated, and I don't think that's been a wise approach. So to come back to the question of talking about vaccines for all age groups, I think we should be talking about what's your risk, what's your benefit, and what makes sense in your situation.
Maybe this isn't in your wheelhouse, but do you feel like that disparity was more of a cultural or political move? Like, we don't want to, fat shame somebody, or we don't want to, we don't want to put the burden of this pandemic onto the elderly. Like, or do you feel like the modeling was actually wrong, or they weren't looking at it right from a different angle?
Yeah, I mean, that's a really good question. A few provinces like Alberta will actually list comorbidities on their website, right? So you can actually see, and what you'll see is people who die of COVID or with COVID often have 2 or 3 comorbidities, and they're often might be cancer, dementia, high blood pressure, and so on. And I find that really helpful information, and I think it should be helpful information to the general public in assessing their own risk. So I'm not sure that information has been withheld in other areas, or maybe not made very public because of sort of concern about shaming. I think my sense is if we say these people are at risk, then everybody else is going to think that they're not at risk, and they're going to carry on. Like I said,
if you insert any nuance into it, then people check
out.
out.
And it's the same as saying older people are at risk or whatever else. Well, then younger people are just going to go out and party and so on. So, but I think that's been disappointing. It's really interesting. I was at the hospital a couple of weeks ago. I actually noticed a screensaver at the hospital, and it was exactly what I thought. I thought it was great. It said, you are at higher risk if, and then it had these different, it's like a slideshow, right? Yep. If you are over 50 and have one of these conditions, or if you are, this particular racial group or ethnic group, it had all this really specific, clear information about risk. And I thought, that's really, really good. I mean, that's the sort of thing we should be talking about, and we haven't adequately talked about. And I mean, we knew early on that the elderly would be affected. I mean, one of the real disasters in Ontario was the fact that there was carnage among our elderly early in the pandemic. I mean, many of Ontario's deaths were among elderly people in long-term care facilities early on. And there's going to be inquiries, and we're going to talk about that and look into it. But if you would actually take away those deaths, Ontario's death rate would actually be significantly lower. I mean, more than 60% of COVID deaths in Ontario are people 80 80 and
Yeah.
above. And if you increase that to people 60 and above, it's 93% of Ontario's COVID deaths. So why don't we talk about that more? Well, some of it is, I think, just not wanting people in general to say, oh, I'm not at risk, so I'm going to carry on. And I think there's been a real obsession with children's safety as well. And this is a whole other issue, but I think this is probably the issue that has led you guys when you were kids to having playgrounds where everything was 1 foot off the ground and made of rubber and you couldn't possibly hurt yourself.
It was
a
great.
bit of safetyism. But there's also, I'll be honest, I think there's been some fear mongering on, social media experts and so on. We saw this in January where, a widely followed, Twitter expert in Ontario said, there's going to be thousands of kids in hospital and ICU by the end of January because of the Omicron variant, right?
Right.
And he said it. He's an expert. I'm not a doctor, and I certainly don't have the qualifications he does. I said, I just can't see that happening.
Yeah.
And by the end of the month when this was supposed to happen, the numbers were very low, and they remain very low, thankfully. But there's been also just a lot of really sensational kind of there's been incidents where public officials have announced the death of, very sad to announce the death of a 14-year-old because of COVID. And there've been situations where the family came forward and said, hey, he had cancer, just the fact that he had COVID really didn't have a lot to do with his death. But again, I think it's been a way to try to get people to take it seriously, to recognize that everybody's at risk. But I don't think that's been a great way of providing information. It's been more a way of trying to get people to act a certain way.
It's like a population-wide move. I think Sam and Will kind of recognized that when we talked to them. That was it was just a policy that was put out there for everybody, try to get the whole masses to try to shift their behavior. But it's assuming that you're not taking personal responsibility, right? It's like if we tell these teenagers they're not at risk, they're all going to go party and then they're going to go see grandma. Well, it's like, or maybe they love their grandma, right? And then no one ever said stuff like that. It was like, maybe they'll go party, but maybe they will also be responsible when they are visiting someone of high risk. If you inform them who is high risk, perhaps they will know when they're going to visit grandma. She's at higher risk than you are. So if you're not feeling at risk, well, you should still believe that she's at risk and not believe that you're on the same kind of risk level. Because if they don't think they're ever going to be affected by it, then they might think that she's not going to be affected by it. So it's just this. It's a very interesting way of trying to get a population to do what is quote unquote right in a situation.
Yeah, so I think some of that is actually about trust, and you can think about trust sort of in a policy context, sort of in different directions. So there's upward trust, that would be maybe the trust we might have of our leaders, right? There's downward trust, the trust they would have of us, right? And then there could be lateral trust that we might have of each other, institutions, and so on. And one of the things that I felt, really after about the first month or 6 weeks of the pandemic, we were all in this together. We were flattening the curve, right? It was a scary thing that, I remember what was happening in northern Italy, right? There were, army trucks carrying out coffins and there was no room in the, it was a really, really scary time. And, at that time, I think there was a fair bit of trust. And then what started to happen was, first of all, I think there was a loss of downward trust. So there was a loss of trust or a lack of trust among politicians, public health, that people would do the right thing. You remember the premier talking about those yahoos, those kids who were out at car meets and
having a couple pops after a game of golf and these freaking guys.
Yes, that's right. I've forgotten about the
giggly pops.
The pops. So, but it was a lack of trust that like you said, people would actually on their own do the right thing. And I think actually governments have realized that now, and they've realized, well, we can't just keep regulating this forever. This just doesn't work very well. People get sick of it. People get angry. People stop doing it. So now I think we've actually started to see a shift, and we've heard this from federal public health officials, from provincial public health officials saying, people need to make their own individual risk assessment. Dr. Fauci in the U.S. actually said this just the other day. People need to start making their own individual risk assessments. Well, I'm happy to hear that, but
so gaslighty after 2
You
years.
said that 2 years ago.
But yeah, 2 years ago, that would have been good. Give people more information, help them to, the desire for self-preservation is pretty strong. It's not always perfect, but you give people good information and many of them will make good decisions. And it's not going to be perfect, but really government regulating it isn't perfect either. In fact, some people will do the opposite. because the government told them, to do this. So that lack of what I sense is a lack of downward trust was part of that policy making. And that resulted, I think, in a lack of upward trust by, lack of trust among people in policymakers. And I think that's going to be a long lasting effect of this pandemic, and the response to the pandemic is this loss of trust in certain institutions and in government and public health. And I think that's really problematic because that's going to spill over into routine childhood vaccines, for example, right? Where there were already in some areas and some demographic groups, those vaccines were declining against things like measles and so on.
Yep.
Well, the trust damage that's happened over the last 2 years is going to have longer term public health effects, and we're not going to know about those for years, but I think they're going to be there.
Yeah. And seeing the our leaders shift is, like you said, it's gaslighting, but it's kind of like, it's kind of an accusation. It's like it's like Fauci saying to you, like, you weren't doing your own risk assessment already. And I don't think people take that very well because they said it 2 years ago, and then
nor should they.
We thought we thought this 2 years ago, and we all have been trying to be responsible. So in our own context, so it's like, now you're saying we need to make our own risk assessments. Not very helpful comment.
Well, no, and it comes after too. And I mean, if you can see this on social media a lot, but there's a lot of blaming of people for getting COVID, right? So you got COVID, you're probably some reckless fool who was out, breathing somebody else's air. Like it's right. So and we heard that a lot, and that actually was causing people to be afraid to go to hospital when they were sick with COVID, because they thought, that they were going to be blamed. And there's still, I'll see this on social media where people are still embarrassed that they got COVID. And that they swear, I swear I did everything right and I still got COVID. Well, it's this highly contagious disease that travels in tiny, tiny particles, long distances through the air. I mean, there are things you can do to improve your chances, but man, at some point everybody's going to get it. But we unfortunately created an environment where it was this moral failing if you got COVID. And that's made things even more difficult.
Well,
so there's a lot of backtracking that I think has to happen, and a lot of where politicians and public health is saying, okay, we did the best we could maybe at the time, but we got to realize now we've maybe done some things that we need to try to turn around.
Like Will and Sam talked about the blunt tool that was used and kind of this approach that was uniform across all age groups. And I think, as you say, it's definitely going to backfire long term with the public trust loss.
Yeah, but just trusting each other. Like you would go to a wedding, or even in church, if you had there was a little smaller outbreak in your church, people are looking around for who started it.
That's right.
It's like, who's the super spreader, right? Like, it must have been a person without a mask. Like, that's not helpful, to have within your community, right?
Yeah, that doesn't grow the body of Christ or like
even
improve
society.
Fellowship or anything.
Right?
Yeah, anything. But on this, still back to the vaccines though, I guess with this uniform approach across all age groups, in this science table thing that Sam linked, I read through that, and they constantly hit vaccines for everybody all the time, like get the full series, which is currently 2 in kids, 3 in adults, 4 in long-term care residents. That makes sense given the varying risk levels. But do you think, especially the Ontario government, did they take a vaccine cures all sort of approach, and have we overlooked other treatment methods that might be preferable based on your risk? I'm no expert, but like monoclonal antibodies or anything in that range.
Yeah, so I think if I try to go back a year, it's been a long year, but a year ago, we had the vaccines. The initial trials of the vaccines were really promising, right? Really high rate of effectiveness. We have to be careful what effectiveness means. In this case, it was against severe disease, and that's another issue to talk about. But it looked really promising, and I was pretty optimistic. I was like, wow, we are going to get 70% of people vaccinated, which would be a great number, and we're going to go back to normal. And remember, right? People are being told, get vaccinated and get back to normal.
That's what everybody said.
Our kids, when vaccines were approved for kids, hey, kids, get vaccinated, get back to normal. And kids are going to hold that against us for a long, long time because it was not true. Maybe we didn't know it wasn't going to be true, but you remember Ontario, and I think you talked about it, with Sam and Will, right? Once we hit 70%, we'll reopen, or once we hit 80%, we'll reopen. Once we hit 90%, we'll reopen. And Ontario is currently, we're ages 12 plus, we're over 90% vaccinated. We're one of the highest vaccination rates in the world. But it hasn't seemed to help us in terms of preventing lockdowns and so on. I think we put too much hope in the vaccines initially. I did. I was pretty sure that by last September we'd have decent vaccination rates, we'd see herd immunity, we'd get back to normal. And really where that went off the rails is when we found out the vaccines didn't really prevent transmission and
Leaky.
infection.
Yeah.
Right. So, and we probably should have known that, but
Yeah.
initially they actually seemed to be doing okay at that. And then really it was, probably around July of last year, US CDC, there was this big outbreak
Yeah.
among vaccinated people. And they're
Yeah.
like, whoa, wait a minute, what's
Yeah.
going on? And it was kind of downhill from there. And I was already noticing
In Israel, it started, right?
Israel is having issues. And I was noticing the UK has really, really good data that they put out. And I was already noticing different age groups, the case rates were getting higher and higher in the vaccinated than in the unvaccinated. I'm like, well, if vaccination is preventing transmission, how can this be? And so, I've been talking about that for a while, and
Mhm.
it's slowly become more and more clear to the point now that, there's no serious, scientist or expert who's going to say, vaccines do a great job of preventing transmission. They may prevent it for a certain period of time. You may get boosted. It'll help for a few more weeks, but the vaccines have really not lived up to that really, really big hope of preventing transmission. They have, if you look at the data on preventing severe illness, they've actually done pretty well there.
Yep.
But that's a whole different thing. So to come back to your question, yeah, we probably put too much stock in the vaccines being the cure for everything. And it's fascinating for me to watch now, with Ontario having lifted mask mandates, right? There's a lot of outcry, a lot of pressure from, sort of media and what I'd call the Twitter doctors
Yeah.
for masks. And all of a sudden it's like, well, like masks are now seen as like more important than vaccines almost. And, even if you're vaccinated, you just can't do without a mask. And I've found that fascinating because
Mm.
2 years ago, the start of this, masks were like, well, Dr. Fauci, Dr. Tam were like, don't wear a mask, or maybe wear it if you're sick. Masks could make things worse, because you'd be touching your face and so on. And we have gone from that to masks just being the silver bullet. And
What are the numbers of masks? Because I honestly don't know. Because now it's like, do you wear it to protect yourself? Is that what it is now?
yeah, well, that's, I mean,
I don't know. I
That's a
honestly
shifting
don't know
narrative
anymore.
if there ever was one.
well, I mean, this is another thing I find interesting is the whole do it for everyone else, right? So this was initially the vaccination messaging too, right? Do it for the people around you, do it for the
Yeah.
community. A lot of people on social media, I got vaccinated to protect everybody around me. And I mean, we're all attracted to that kind of messaging, right? Like I did this selfless, noble thing,
Yeah.
as opposed to like, I got vaccinated because I don't want to end up in ICU or the cemetery, right? That sounds pretty
I
selfish.
protect me.
Even though
Yeah.
it's I don't think that's a terrible thing to do. We try to be healthy for
It's fair, but no social media brownie points.
it's not it doesn't feel as like saving the world. So
Yeah.
and I think that's one of the reasons we had trouble letting go of the idea that vaccines would really prevent transmission, because we're like, well, if they don't prevent transmission,
What do we
and
know?
you mean I'm just protecting me and not everybody else, and they need to get their own, right? So and I think the same thing has kind of happened with masks. So initially it was, you're going to wear a mask to protect those around you, and it's not so much about protecting yourself. And there's a little bit to that, and that's because early on we thought that COVID spread largely through droplets, right? So larger chunks of goober, for lack of a better word,
The scientific
that
term.
would travel.
Moist speaking.
Moist speaking, as the prime minister would say, that would
Yeah.
travel 5 or 6 feet, right? So if we're talking now, and maybe
Across the table.
it's gonna be across the table. So if you distance by 6 feet, you wear a mask that will stop my spray from flying, and so there's actually some logic to that, right? So me wearing a mask maybe will protect you. There wasn't a ton of science to that, to be honest, but there was
Common sense.
Well, we saw
some
that.
logic.
We saw the spray model.
Oh
from
yeah,
that
I mean you get all these kind of
with the model of the guy shooting a spit around.
absolutely. There's that, and then there's like the memes of like people pee in their pants, and if I'm wearing pants, you're wearing pants, we won't pee on each other, and there's all kinds of stuff that. But
I don't think I saw that.
so no, that was really
deep.
What if the puddle becomes more than 6 feet?
yeah. Well, I guess you gotta
You got a big
move.
bladder? Yeah,
You gotta
too.
move, but some of these so you would have lab studies, right?
Yeah.
Lab study, you can say a mask stops transmission over a certain distance. Problem is, real life often is quite different than the lab. When we found this, initially lab studies showed that COVID could live on a surface for days and days and days, right? So we started bleaching our groceries and doorknobs, and we've never haven't stopped a lot of that. They're still washing doorknobs like crazy, even though there's almost no known cases of what fomite transmission, so from a contaminated surface. it's just not there. But
Yeah.
but we've had trouble letting go of that. So when it comes to masks, I mean, I think right now if you're wearing an N95 mask properly, it actually provides you with pretty good protection. And if I were somebody who was particularly vulnerable to COVID, I would probably
Protect yourself.
be thinking of that to protect myself.
Okay.
Do I think that's going to protect other people around me? I'm not sure. I guess if I have COVID, it does. But if I have COVID, maybe I shouldn't be out and about anyway. So the problem with mask mandates in general is that you're not having everybody wearing properly fitted N95s. You're having kids wearing their SpongeBob mask, and it's hasn't been washed for a few days, and it's not. And cloth masks, they've been compared to like having a screen door on a submarine. I mean, they don't.
We saw your grandma knitting some. That were like, dude, you can put your fingers through that.
Yeah, I mean, I think right. So mask mandates, I don't think mask mandates are effective at all, and it's not because a good mask won't stop, transmission of the virus. It's because you're not going to be able to mandate everybody in the population to properly wear a good mask. And the stuff that you've got kids wearing in schools and stuff, and taking it off to eat and whatever else. I mean, it's just not worth it. And you look right now at Quebec, which has mask mandates, right, and which has much higher case numbers, hospitalization numbers than Ontario. I mean, there's all kinds of examples.
Yeah.
So,
but like like the everyday blue masks, are those surgical masks? Is that what they call them?
Yeah. So if you get a medical grade mask, I mean, it depends where you get them, right? In theory, they should have multiple layers and so on. The problem is you've got to fit it really well, right? So if you think about the size of the virus as being really like cigarette smoke, right? So size wise, cigarette smoke particles are a pretty good comparison.
Okay.
Right. So think about, okay, if I were smoking, right, and you're wearing masks, what's it going to take for you to not inhale my smoke? Right. I mean, that's a good thing. So if you're wearing a blue mask and you've got, spaces around the side, I mean, yeah, maybe you're going to slow down the smoke. Maybe you're going to inhale a little bit less, which might be beneficial. But it's not likely to stop. And the longer we sit in the room together,
but that's
so if we were together in a room for a minute, that might actually help you a little bit, right? If we're 10 minutes, probably not. In that context, you could put a good N95 respirator mask on, properly sealed, and you could probably be there indefinitely. But most people aren't wearing those, and they're expensive. And I mean, I'd love to see the government provide those to vulnerable people rather than, again, just trying to tell everybody to wear their SpongeBob cloth mask or whatever else has been happening.
And people are touching them and wearing them with a beard. So
yeah, I mean, it's just
your beard's really helping the seal on that thing.
Yeah, exactly.
Huh. Wow, we're flying through the time here, but okay, I want to get to Texas and Florida because Sam referenced that a lot. I think it's more complicated than what he made it out to be, but let me just get to what his point was on that. He agreed basically. Okay, so the criticism was Sam and Will defended lockdowns based on Texas and Florida mortality numbers, 4 times Ontario. Is this a fair comparison, or are there more factors involved? And then Sam said, for sure, there's always other factors in every comparison, but these are the most commonly referenced by those who oppose the measures taken by the Ontario government. All right, is it a fair comparison?
That means policy-wise, right? Like that we did lockdowns, they did not lockdowns.
Yeah,
and then we looked at it.
They took very, very different approaches. They got 4 times more people who died than us. So therefore, Ontario was right.
4 times more.
Yeah. So I mean, comparing any other jurisdiction is complicated now. And I know both sides use Texas and Florida. So one side will say, look, they had no restrictions and their cases went up and down in a similar pattern to others. And I think that's fair. And actually, I think it's a really important point because I've often compared Ontario to Michigan, and because Ontario would impose restrictions, and this is sort of the pattern that happens. COVID, generally, the waves have gone up fairly sharply, and then they've gone down in most places. And with more transmissible variants, they go up and down faster. They go up really, really fast, come down really, really fast. And what tends to happen then is, as they're going up fast, our policymakers go, whoa, this is getting really bad. We're under a lot of pressure. We need to do something. So we do lockdowns, we do masks, or we do whatever. And then shortly thereafter, the cases peak and drop. And inevitably, the government, because this is, politicians want to get reelected, they say, see, look what we did. We imposed measures and bam, it turned around. And then they relax the measures when we get to the bottom of the trough. And then a little while later, another wave starts, and then they get blamed for having reduced the measures too soon. It's helpful to look at other jurisdictions and say, well, when they didn't do anything, cases still went up and down in a very similar pattern to ours. In fact, I've sometimes mapped Michigan's over Ontario's, and even with, very, very different restriction situations, it's amazing. Sometimes even to the day how they go up and down because the virus has its own
Well, it's
cycles.
actually a helpful jurisdiction too,
Yeah.
because it's so this
Sure.
climate's similar and
Population
probably
wise.
similar density even.
Yeah, yeah. So similar population, maybe some similar demographics, similar climate, because I think that's a factor as
Mm.
well. So it is helpful, I think, to look at other jurisdictions and say, look, sometimes the lockdowns are not driving, or lack of lockdowns are not driving it. That's one hand. Now, the other hand, the other side will point to them and say, well, they have a much, much higher death rate, therefore our lockdowns work. And I don't think that that actually is something that's backed up by the evidence. Yes, they have a much higher death rate, but every U.S. state has a higher death rate than Ontario.
Mm.
All right. And that includes states that heavily locked down. So California and New York, which had lockdowns similar or even greater than Ontario. I mean, New York requires masks on toddlers still, to this, right now. So, and yet they have a higher death rate. So why is that if lockdowns are reducing the death rate? You can compare Texas and California. So California with a lot of lockdowns, Texas without, their death rate's pretty similar.
Hmm.
So I don't think you can make the argument that, those death rates themselves prove that our lockdowns work. There's so many different variables, right? There's the population health, there's access to healthcare, there's human behavior, there's the age of the population, right? Florida, for example, having a more elderly population. So there's all kinds of things going on there. But it gets really interesting if you stop comparing to the US, which has generally had a rough time with COVID, you start making other comparisons. So why does Ontario have a much higher death rate than BC? All right, I mean that's interesting.
Mm.
Why does the NDP government in BC have a lower death rate than the PC government? It's in Ontario. Is it that they were locked down harder? I don't think so. In fact, I don't think their schools were closed as long as Ontario's were. But then Quebec has double the death rate of Ontario, and I'm talking per capita. So
Yeah,
so it's
Yeah.
so why does
And
Quebec
they
have
did curfews.
they
and-
had a curfew. They did everything they could. So this idea that the lockdowns kind of directly influence the death rate, I think is a bit of a stretch. I
Yeah.
think you compare internationally, right? So compare Canadian death rate per capita, right? Why are we higher than? We're a little higher than Denmark. We're way higher than Finland and Norway. And I use those countries because I think there may be some similarities in terms of the healthcare system and
Yeah.
population and so on, right? We're way, way higher. So I think you got to be really careful in saying, hey, our lockdowns prevented this many COVID deaths. I don't think that's necessarily
Yeah.
clear. And that's without getting into the issue of, well, how much collateral damage was there?
Yeah. Sam also pointed to the what was it? The increase or the decrease in life expectancy. I think that number, and he said that ours. I think
Is
we went
the same.
back a half year or something, and
Very
in
similar.
Florida something went down a year and a half or something like that.
Yeah.
So I mean, yeah,
But that's just gonna be reflective of the overall mortality numbers too, right?
yeah,
Yeah,
but-
and that's really, I think, what we should be looking at is looking at excess mortality, right? So
yeah, excess mortality. Yeah,
I've often talked about something I call COVID exceptionalism, which is COVID is so exceptional. We don't want you to die of COVID. Like you can die of anything else.
Yeah.
Just don't die of COVID. So, if we're gonna take this measure and we're gonna stop 100 COVID deaths. So, we're gonna add 50 overdose deaths and we're gonna have 200 more cancer deaths, but at least we stop these COVID deaths. And I'm being a little bit tongue in cheek, but sometimes that's actually been this obsession with we must stop COVID at any cost. And some of those costs have been really high. So I think when we compare to other jurisdictions, we need to compare overall excess mortality. How many people die beyond what would have been expected based on previous years? And did the lives that we saved from COVID, if we saved lives from COVID, were those, outnumbered? I mean, we've had some just incredible overdose numbers. I think especially BC, but all provinces, right? I mean, let's start adding up the other impacts. We don't know the impact now of delayed cancer screening and diagnosis and treatment and so on. And some of that's unavoidable. I mean, your hospitals are absolutely full of COVID patients. I mean, there's not a lot you can do about it. But some of it has been hospitals that weren't treating a lot of COVID patients, which were still told stop doing other procedures and so on. So I think if we're going to talk about the death rate, I mean, consider all the factors, but also consider the overall impact. I mean, lost education to kids actually affects their life expectancy as well.
That's
Right.
the
So,
true.
so
That's
that's,
what I'm thinking
World
of.
Health Organization has been really concerned about, around the world, interrupted education to kids. That actually has long-term effects. And we don't see that yet. You don't see that in this month's death rates or the other metrics that are often in the newspaper and social media. these are things that I think need to be balanced out as part of the policy as
But
well.
you didn't see that like week to week or day to day, week to week, month to month. But now that it's been a year, you're starting to see some of those impacts. Like you're hearing anecdotal evidence from families or parents who are saying that their grade 1 kid can't read the same as their other grade 1 kid could. And you're starting to see that, like, yeah, university kids are struggling more because they have to be online, or so, like, yeah, I guess it's just those things that hadn't been apparent, like, and it's impossible to even model or gauge, but now you're seeing that, like, longer term stuff start playing out. But
Yeah,
I
well,
mean,
if you think, if, for a kid who's 4 or 5, how much of their life has been pandemic, right? Like
oh, I
that's
know.
a really
Half.
large proportion of their
Yeah.
life, and I
My
think
son was born like at the beginning, and it was like,
so
yeah, he
the
hasn't
entire
lived,
life.
like, he doesn't know, like, and he's only what is he, year and a half? He doesn't know that, yeah, he's a year and a half. He
Your
doesn't
child, yeah.
he doesn't know that when you go to a grocery store, other people have faces,
Yeah,
right? Which
yeah.
is like, it's crazy. And I have my 3-year-old telling my wife that she's got to put a mask on now, like now, even that the mandate's over,
Yeah.
right? Like they
Because
did,
that's just
because
normal.
that's the reality. It was
Yeah.
like, and so that we don't know what the impact of that has. So it's, yeah,
Oh man,
something that we're nice and scared of.
yeah, so many things to get to there. Yeah. Okay, I'll just throw it out to you in general. Like, any other topics you want to make sure you hit while you're here?
Well, I mean, I think vaccine passports to me is,
Yes, that's a
that's
big
an
one.
issue I'm very passionate about from a
Mm.
both from a justice perspective and
Yeah.
from a public policy perspective. I
Yeah.
think those are, and I'm not convinced they're gone. I mean, obviously federally they still exist for travel,
Yeah.
but I don't think, I was interested because I think it was Sam's comments suggested that they know I don't want to misquote, they knew they made a mistake or whatever else. I was curious about that because I haven't heard the government say, hey, vaccine passports were a bad idea. I mean, no, I know Doug Ford said, I'm not going to keep them one day more than necessary, but
Trudeau said the same thing.
yeah, that's turning out to be pretty long time federally
Yeah.
and provincially. I mean, I'm concerned that they'll be back, even though I don't think there's evidence that they work, and even though I think they do a lot of harm.
That's the tough. Yeah, I mean, that's such a tough thing. Even nationally, like
Yeah.
interprovincial restrictions, it just makes no sense.
Yeah.
Something we're still gonna battle. But you think we're gonna battle that more in the rest of our life, like, going on vacation down south? And at this point, if you decided you're unvaccinated and you wanted to go to Florida, it would take you like 7 months to get all the paperwork together that you need to get there, because you need to get vaccinated and wait, and then another booster, and then wait, and then you have to, I think it's like 2 or 3 months you got to wait before you after that you can still board a plane. Like,
Yeah, it's hard,
It's a
it's hard to
process.
say where all that's going to go. I mean, I think Canada is a bit out of step with other countries in terms of what we're requiring for travel. But one of the concerns I have with passports, and it's true with lockdowns and masks and so on, is at a certain point we just start assuming that they work, right? So
Yeah.
we don't have a real good review of did they work. So if we would review Ontario's passports, for example, right? They're imposed for 3 reasons, right? One was to stop outbreaks and transmission. One was to prevent lockdowns. One was to increase vaccination rates. So, do we have a good review that this actually happened? Well, I mean, we know that they didn't stop transmission. We have data on that. We know they didn't stop outbreaks. The places that required passports, so gyms, restaurants, and so on. By this past December, their outbreaks were higher than they ever had been. So it wasn't stopping outbreaks there. Clearly didn't stop lockdowns because we locked down again and closed school again. And whether they increase vaccination rates, and it's pretty hard to tell. There's an initial short-term bump, where people, booked it, but or booked their vaccine appointments, but there hasn't been a huge change to the rates either. And our rates were very good before the passports, and they're even better now. But there are lots of other programs that were increasing vaccination rates. So I think it's really important from a public policy point of view as we take a look and say, did this work? But we seem to skip that stage with some of these policies, and we just move from let's try this to now this is part of our toolbox and we'll pull it out again when we need it. And that's really alarming because I think we could just end up repeating mistakes because at a certain point we just assume that they work.
so what do we do as just lay people, I guess, to encourage our leaders not to do that? Because you see, like, if the Ford government gets in again, we're in for another 3-4 years of this same thing. And if they use the precedents that they've had over the last 2 years, like, we could see this for a common cold. I see even Dr. Moore said in his speech today or yesterday, he mentioned the flu in the same sentence as COVID in the fall. Well, it's like, so now did we move the bar on this whole thing? And then are we going to start using measures for like this public policy measures for, just things that we weren't concerned about 2 years ago?
Like, do we have an exit strategy out of this right now?
Yeah, and I mean, I think the provincial government would say yes, we do. I mean, you talked earlier about where we use in early treatments often, enough, and we weren't, but we're starting to get there now, right? So I think we have some parts of a strategy, but I'm afraid that the strategy is also, well, we'll simply reapply the same measures once this gets bad again. This will happen again in the fall. The cases are going to go up
for sure,
and even with high vaccination numbers, we know that doesn't stop cases from rising. People end up in hospital. And I'm afraid it's just going to be this reflex where we just do the same things we're doing without actually assessing whether it works. Because it just becomes almost, it's like common knowledge. Like, I'll hear this from lots of people. It's just common sense that masks work, that vaccine passports work, that lockdowns work, and so on. Well, I don't think it's common sense, and I think it should be based on evidence. One of the challenges has become very political, right? So if you're on this part of the political spectrum, you believe in whatever these restrictions. If you're this part, you don't believe in these restrictions, instead of being evidence based. And so in terms of your question, what can we do? I think we have to keep calling for evidence and data and keep pointing to that and keep raising that with people like Will and Sam, who I think they're reasonable and they want to do the right thing and they're willing to listen, and just keep saying, hey, this doesn't have to be a political issue. This is an issue of policy and an issue of health and an issue of justice. And how are we sure that these things work, and what might work better? I mean, there are ways. I've proposed lots of different ways that we can move forward without having to choose between, on the one hand, let's do nothing and just let it be. On the other hand, let's be super restrictive. I mean, there are ways in between that we can use that can be minimally disruptive to society, but can still protect people who need to be protected.
Yeah, for sure. Yeah, I mean, let's hope we see that message pounded over the next 6 months, that people, like, they've spent the last few years using the blunt tools that they have used to pound it into the population that everybody should be scared of this. And now they have 6 months to kind of change that messaging around. So when the fall comes around and we get this inevitable spike, hopefully there's not as much pressure to use those tools.
Yeah, it'd be interesting to see, like, once a government's reelected, what is it? It's June, right?
Yeah, June.
Once we get another provincial government, how well they get along with the federal government too, because right now it's like they're in each other's pocket and they're just going along with whatever they say.
Yeah,
it'd be interesting to see if that changes before it gets in again.
Yeah. I mean, there's definitely more to talk about. There was still more feedback. I know we wanted to focus more on the stats. That's Ed's area of expertise. I mean, we did mention a bit early on, but just about some of the arrogance that was just presupposed in some of these policy decisions, and that, like, you can claim credit for saving lives or that they have responsibility for the lives that are lost. Some people wrote in saying basically that to do that for a virus that was inevitably going to make its way through a population seems like the government trying to play God. And then, kind of a related point to that, another one, Sam's case about preserving life, quote, as much as we can, in Lord Say 40, was off the mark. We don't deserve only, quote, good outcomes. We should be able to say that honestly, as with Job, the Lord gives and the Lord takes. Blessed be the name of the Lord. We deserve whatever God brings us and no better. That disobedient government overreach and abuse of power may have saved lives does not justify it. Whether or not they have such authority from God to do what they did is another topic which can be discussed elsewhere. But the end itself, the preservation of life, should not be taken for granted as the single justifying factor. We have to be careful we do not make life out to be an idol. And then, just to get to Sam's response to that, he agrees life should not be an idol. But what makes it disobedient for the government to seek to protect life in a situation in a once-in-a-century pandemic? Where is the line between thoughtful preventative measures, which prevent us from harming ourselves or our neighbor, and disobedient action? And that's been the key point throughout all this. That line seems to differ for different people. The argument about whether or not the government has the authority to do so, in fact, is a discussion for a different time, but completely integral to the government's action. If a government has authority to do so, that is very important to the conversation. So again, this kind of touches on going forward, right? Like, where is that balance going to lie? And how can the government chart a path that is minimally intrusive, yet still protects vulnerable populations? Yeah. Do you agree that they've kind of had a bit of arrogance in how they've approached this in terms of seeking to do more than they actually can do?
Well, I think there's been arrogance in the sense that thinking that we can, that everything that's going to happen with the virus is a result of our actions, right? So we
Yeah.
can control it, we can stop it, we can change it. So that's, and I think that's not just our government. That's been a human.
For sure.
That's been a
For
human
sure.
approach. I mean, I like to think of the organization of society in terms of sphere sovereignty and sort of the different roles of the different institutions. And I certainly have no problem saying part of the government's role is that of public health, right? And dealing with diseases and disasters and so on. I mean, I think that's a responsibility of the government, part of the government doing justice and keeping order and so on. And obviously that bumps up into other spheres, right? I mean, bumps up into the church and the family and so on. And there can be a lot of arguments about, did it go too far in one direction? Because I think that other parts of society can also have responsibility in those areas, and it should be shared. And it's not necessarily all government.
Yeah.
In terms of preserving life, I mean, I think that's a pretty key role of government. I mean, obviously, it shouldn't be the interest in do we preserve life at the cost of anything. Um, my concern is that we actually focused, as I mentioned earlier, on preserving life from COVID,
Mm.
and not looking at the overall impact on society, and saving a life from COVID and creating two or leading to two deaths from something else. To me, that's not actually preserving life. And I think the other thing was maybe insufficient attention to preserving life at what cost. So when you talk about elderly people in long-term care facilities who are prevented from visiting with family members, prevented from leaving. In some cases, I mean, there are horror stories of being locked in their room and doorknobs removed and so on. Obviously, that's not government policy, but this, we're going to save your life even if we make it completely miserable, right? And I feel that that's something where we maybe could have thought about it differently. And one of the ways would have been to ask some of the people involved actually what their priority was. Maybe their priority was, well, I'd actually really, really like to see my grandchildren, even if there's going to be some risk, as
Yeah.
opposed to you locking me away for a long period of time. I can't
Yeah.
see anybody because you're saving me. So I think there has to be that discussion too about, um, and again, it keeps coming back to with any policy, the benefit versus the
Mhm.
harm. And I didn't see a lot of that when governments talk about, we're imposing this policy. Um, and we think here's the benefit, but we think that here's some of the downsides. It's always been kind of, this is all good, we're going to do this, right?
Yeah.
School closures, right? We're going to do this because it's going to make schools safer, even though they're already safe. And there's not much of a downside because kids are resilient. And we'd reopen schools because it's so important that kids be in school, and it's extremely important to their mental health. Then we close schools like it's no big deal.
Yeah.
So the balancing of benefit and harm should be a part. That's a fundamental part of policy making,
Mhm.
and then also just evaluating, has the policy worked?
Yeah.
Have we achieved what we meant to achieve? And I think those have been missing.
Yeah.
The harm benefit analysis, the evaluation of whether it worked, and the other part from a policy perspective that's been missing has just been, how have we defined the problems that we're going to solve? I'm pretty sure that at many points of the pandemic, we weren't even sure what we were trying to prevent anymore.
Mhm.
Were we preventing the hospitals from being overwhelmed, or are we stopping the spread? Stopping people from getting infected. Are
Yeah.
we trying to reduce daily cases? Are we trying to protect ICU? It became very, very,
Mhm.
very muddled. So some of that's government overreach. Perhaps some of that I think is human arrogance, thinking we can control everything. Some of it is maybe not having a clear enough understanding of sort of the boundaries between sort of different spheres and institutions.
Yeah.
And hopefully we've learned from that and can go forward and do it better. But I'm not always convinced.
Yeah.
Yeah, you mentioned sphere sovereignty, and reading this makes me think of, well, if this was your, like, if this was a parent and a child relationship and not the government and the public, it kind of gives me the feeling that, like, society has become this like safe space culture. We've got like helicopter parenting, and like everyone's looking out for, or that, people are looking out for their kids, and everyone's trying to make everything safe for everybody and not trigger anybody. But if you think about like helicopter parenting specifically, a parent is trying to prevent their child from harm. Well, that's easy when they're like in your, like, under your umbrella around your house, but it's not obvious that that is helpful for them long term. So is it really helping? Well, yeah, maybe immediately because they don't fall off of some,
seesaw.
Yeah, they don't fall off your retaining wall in the front of your house, but also like maybe falling off that thing, would help them long term understand what risk is, and then maybe that pushes out into more of life. So having the government tell everybody how to um, stay safe. It's also something they can't control because the public's not under their watchful eye 24/7, right? So it just seems like an unhelpful way to push someone who's below you into into kind of like a submission kind of attitude. And then when they come out of that, that's not really a helpful or constructive um, person or society anymore. So it just made me think like you kind of got to look at all the spheres and yeah, government government should probably consider some of these things. So
Yeah, and I think we've seen friction obviously between sort of state and church, right? When these things bump up against each other, and but a lot of it comes down to trust again, right? So if there is a deep trust in government and public health, and the government said, look, I really suggest you wear a mask or stay home or whatever else, right? If there's a deep trust relationship, then maybe there's not a need to even impose a law or a regulation. People and then there'd be further, we're going to give you really clear information on risk. We're not going to try to sort of message it to create a certain, behavioral pattern, but we're going to trust that once we give you this information. It would have been a really different way to function. And maybe this is just a really bad, reflection on where our society is at in terms of trust in institutions and trust in each other and willingness to go. And perhaps we're going to find that societies where there were much deeper levels of trust and cooperation, that things could actually work much more smoothly without the government saying locking down playgrounds or closing schools or doing some of these other measures.
Yeah, for sure. Well,
it's been a road. Hopefully we put COVID
to bed. I would say the takeaway is contact your local reps and ask them if they have a plan and what their metrics are for getting out of this, because I think that's the way we can change things if there is a possibility of change. By the time the fall rolls around, if the politicians change their messaging and this becomes less about everybody's problem and more about, yes, you have a responsibility, but just be careful around those who are vulnerable, and we can return to normal life essentially. I think
a push for accountability or a push for some form of justice in this thing, right? Like
an inquiry,
an inquiry, an evaluation of whether or not these things were properly done. Because without that, and I'm not even saying that to like say, well, we need to hold these people accountable, and they should be held accountable for the deaths or whatever. Like just so that we know for the future, like so we have it on the books, right? So we have, when the flu is pretty bad next year, we're not running for lockdowns again and let's shut schools down, or like that's not becoming a common public policy. So.
Yeah. Any closing thoughts, Ed?
Yeah, no, I'm hoping next fall that or summer or whenever the next wave hits that it will be different. And I'm hoping we can get to the point where the government is definitely looking after people who are vulnerable, because I actually think that right now some people who are vulnerable feel like they've kind of been just left on their own, and I don't think that should be the case either. And we got to get away from this sort of one size fits all approach and say, okay, for these people who are particularly at risk, we're actually going to go above and beyond. We're going to do things that will help keep them safe. At the same time, we'll try to be minimally disruptive to people. And particularly, we're going to admit when people are at low risk, particularly children, we're going to admit that, sometimes our cure, our keeping them safe is actually really unsafe for them, is actually doing a lot of harm. So hopefully, our elected representatives and our public health officials and so on, we'll be able to get to that point where say we are going to try really hard to do a better job of protecting the vulnerable, and at the same time recognizing that health is more than the absence of COVID, right? And I think that's really, really important. Just removing COVID from the picture doesn't mean you're healthy. Health is far broader than that. It's mental health, it's physical health, it's spiritual health, it's emotional health, and all of these things should be taken into consideration. And don't put COVID on a pedestal. We can't ignore it. We can't pretend it's not there. But at the same time, let's make sure we understand that human beings are bigger than just do they test positive or not on a rapid test.
Wonderful. Alrighty. Well, thanks for coming. We appreciate your time.
Thanks for having me. Really appreciate it.
It was wonderful.
Hopefully we never have to talk about COVID.
Yeah, I think
otherwise maybe we'll come back in the fall and maybe have Will and Sam and me here all together.
If golf courses close again, you'll be here.
Ski hills, golf courses,
boat ramps. You can go out in a boat.
Perfect.
Yeah. Putting COVID to bed with Ed Bosveld.
Yeah, there you go.
There's the title. Wonderful. All right. Well, thanks, folks, for listening.
Yeah, let us know what you think about these new feedback things. We're going to try to, make them more less us talking and more useful people. So, thanks, Ed.
Should be
Thanks
fun.
for having me.
All right. Keep having real talk. Catch you next time. Thanks for tuning in to this episode of Real Talk. We really appreciate you taking the time to listen or watch the show. If you want to send us your feedback, and we'd love to hear it, please email us at reformedrealtalk@gmail.com. If you want to find us online or social media, we got a lot of great content there. Just search Reformed Real Talk and we should come right up. This show is created and produced by myself, Lucas Holtfluer, and Tyler Vanderwood, and our wonderful podcast manager who does all the editing is Mariah Tamiga. So we're really thankful for her contribution to the show as well. That's all for now, folks. Thanks for watching or listening, and we'll catch you next time. Bye-bye.